Hi, Paul Slackers, Good News Broadcast, speaking to Dr. Donald Perlman. Hi, Doctor. How are you?
Oh, very good. How are you?
I'm good. You know, I'm always happy when I get the chance to speak with you. We've been doing this for some years now, especially during this flu concerns. And the doctor Perlman is with a family health and flu expert from Newark, Beth Israel. It's Newark, New Jersey. And he always gives us a good perspective. So how is this year with regard to flu and people taking flu vaccinations, and what should we be doing this year?
Well, the CDC has their recommendations of an initiative called Take 3, where they suggest that people get vaccinated and that they become aware of the flu symptoms so that they can avail themselves of antiviral medications to treat influenza, and as well as to practice good personal hygiene so that they don't help stop spreading the disease from one person to the next.
Okay, give us once again the comparison between flu and a cold.
Well, that's I'll tell you that, but you can get some very good information at your leisure from a site, flufacts.com.
And
at that site, if you put your zip code in, you can find out if flu is in your area. The symptoms of influenza are dramatically different from those of a cold. Influenza is very dramatic. It comes on very suddenly. My patients tell me they feel like they got hit by a train or the house fell on them. One minute they're fine, the next minute they feel very weak, feverish, tremendous body aches and pains, joint pains, muscle pains, cough and fever and chills. And again, sudden onset, different than a cold. So if you feel those symptoms, and I think it's important for people to be aware of them, if you feel those symptoms, even if you've gotten a flu shot, it's important that you call your doctor, because if you're going to get a prescription for a antiviral medication like Tamiflu, it needs to be obtained within 12 to 48 hours of the onset of symptoms for it to be effective.
Now, what is Tamiflu?
Tamiflu is a prescription antiviral medicine. It actually works by affecting the neuraminidase system of the virus.
Okay, so, and that's, you drink that or you take it by pills?
Well, it comes as a pill for adults and a liquid for children down to the age of 1.
Okay.
It's readily available, it's safe, and it's effective. It shortens the duration, the severity, intensity of influenza, and can very dramatically help prevent the complications. And it can also be given to healthy contacts of infected people so that they can prevent them from getting the flu. And studies show that's about 92% effective.
Oh, wow. Wait a second on that one. That's different. So you're saying that, all right, so your kid has the flu, and you get the flu shot, that's one thing, right?
That's the most important.
And then you suggest also, how old do you, what's the age? Is there age concerns here with taking a flu shot?
Yeah, no, the flu shot, the government this year recommends that everybody from 6 months of age through 18 years of age gets the flu shot. They also recommend that anybody over 50 and anybody who has a chronic illness like diabetes, heart disease, lung disease, and the people who take care of them get a flu shot. Even pregnant women especially.
Even a pregnant woman should get a flu shot?
Absolutely, because they can't take the antiviral medicines.
Okay.
There's a very small group of people who are allergic to eggs who can't be given the vaccine at this time. And again, antiviral prescription medicines would be very effective and important for them.
Now you say okay, so that's the flu shot. Now, Tamiflu, right?
Tamiflu.
You're saying that somebody could take that also. Could they take? They shouldn't take that before they have the flu, right?
Well, they could take it if, for instance, if you had influenza, the people at work who don't have influenza, or your family, they could be given Tamiflu preventatively.
Interesting.
To stop them from getting the flu.
Okay, because how contagious is the flu?
Oh, it's extraordinarily contagious. If the vaccine is not given, or if it's not a good match, it will definitely infect anybody around. It's very, very good.
And how does it do that?
Well, it does it by droplets, by coughing, and by breathing. Pretty much if you're in the room with someone who has influenza and they cough a few times, you're probably going to be exposed to it.
Okay, so, and that is, I'm going to do a little more scientific on this. I cough, all right, I'm putting out some, I don't know, what am I putting out there?
You're putting out viral particles, influenza particles.
That I can't see.
Interestingly enough, the antiviral like Tamiflu stops those particles from coming out and being reproduced. So it's a very effective mechanism.
Okay. And if you didn't use that, you have viral particles that are actually coming out. You don't see them, right? I mean,
no, they would be very tiny microscopic droplets. That's why it's interesting that the CDC has suggested that we cough into our elbows. That way, if you cough into your hand or a Kleenex, and you touch something with that dirty Kleenex or put your hands on things, that spreads the virus.
I remember you mentioning that last year. That was a new one on me as well. All right, so now how about places that are quite commingling overall in general in life? We take the subway, we're holding onto the railing.
Oh, absolutely.
Bad news?
Absolutely. And, again, the children are in daycare and school. They cough all over each other, touch everything, touch each other, and they bring it home. That's why the CDC is very keen on inoculating children, because they're the real reservoir for this. If they could effectively stop children from getting influenza, it would probably not spread to most of the rest of us.
So is this a good excuse for a kid to say, or like a teenager say, I can't go to school today, I might get the flu? What do you think, Doctor?
I don't think that would be appropriate, but certainly if you know you have the flu, you ought to stay home.
I would have tried anything. No, I'm just kidding.
Me too.
Okay, we have flufacts.com on the website here. What's good news for Dr. Perlman?
Well, I think, again, cdc.gov is also very important.
Okay.
And I hope your readers will certainly go out and get flu shots. It's very important, and I hope the mythology that suggests that they cause the flu will be dispelled. That is not true. It's a killed virus vaccine. It cannot give anybody influenza. It's impossible.
Okay, and getting the flu shot when you have the flu?
Well, you need to get it before you get the flu. But once you have the flu, you can call your doctor and get a prescription antiviral medicine like Tamiflu that will treat the disease.
Okay.
You don't have to take it lying down, for sure.
How about if you have a cold? Can you get the flu shot when you have a cold?
As far as I'm concerned, yes. But you'd want to know it was a cold and not the flu.
Gotcha. Okay, Dr. Perlman, thank you very much for sharing important information once again.
Thank you very much for letting me join you again, Paul.
Okay, take care.